The nursing care plan priority number 2 is hyperthermia. And starting with the assessment, we have gathered these data, subjective and objective data, and the results from antigen and RT-PCR tests are also positive. And the vital signs of the client, which are presented on the screen. Now, for the diagnosis, we have come up with this nursing diagnosis. Hyperthermia related to viral infection as evidenced by body temperature of 40.6 degrees Celsius, chills, and warm to touch. And for the outcome identification, the client will be able to report and present manifestations that hyperthermia is relieved with stable and normal vital signs, increased energy, and replenished fluids. Now for the planning, we have short-term and long-term plans. And for the short-term, we have the first 30 minutes of nursing interventions, and the client is expected to demonstrate a temperature from 40.6 degrees Celsius to 38.5 degrees Celsius. Then after 4 hours of the nursing interventions, the client is expected to demonstrate normal body temperature of 36.5 to 37.5 degrees Celsius. For long-term plan, after 7 to 14 days of nursing interventions, the client will demonstrate absence of active infections as evidenced by normal body temperature of 36.5 to 37.5 degrees Celsius and a negative result from the PCR test. Next will be the nursing interventions, and starting with the independent nursing interventions, begin with the performing hand washing and applying personal protective equipment. So these are the first line of defense for the nurses to be safe. And then the priority intervention is to assess and monitor the client's vital signs, especially the temperature. Next is adjust the environmental factors such as the room temperatures and linens on the bed. And then remove excess clothing of the client, apply tepid sponge bath, and encourage the client to increase fluid intake. For the dependent nursing interventions, we have to administer antipyretics and antibiotics as prescribed by the physician, and also administer intravenous fluids if indicated. Then for the evaluation, short term, so after 30 minutes of nursing interventions, the goal was met, and the client's temperature has decreased from 40.6 degrees Celsius to 38.5 degrees Celsius. Then after 4 hours of nursing interventions, the goal was met also, and the client has demonstrated normal temperature of 37.5 degrees Celsius. Then for the long term, after 14 days of the nursing interventions, the goal was met, and the client is now free of active infections as evidenced by normal temperature and negative PCR test result.